The information shared on CNS Unfiltered is for educational purposes only and is not intended to diagnose, treat, cure, or prevent any disease. Always consult your healthcare provider before making any health or lifestyle changes. The views shared are those of guests and do not necessarily reflect those of Innate Clinical Nutrition or its affiliates. This episode includes affiliate links, which help support the show. Hello and welcome. I am Jena Salisbury, and this is CNS Unfiltered, a show where clinical nutrition specialists uncover what traditional medicine overlooks. Welcome to our second Journal Club episode of the show. It's Q2 already. Can you believe it? If you're new here, we just started a segment that we're doing once per quarter called Journal Club. Once per quarter, we'll discuss some of the emerging research in the field of clinical nutrition. But we're doing this with the authors of the papers themselves. Each episode, I'll review a paper with the author and ask them questions about the research that guided that paper. They'll share their process, talk about their personal practice and experience, possibly touch on case studies that may have impacted their research, and explain what they thought the biggest takeaways were. Reading and understanding research is so important in this field. It's how we continue to grow and cultivate a deeper personal practice. These Journal Club episodes align with my bigger vision of building community and support for nutrition professionals. And they're a valuable way for both emerging and veteran CNS practitioners to stay up to date on the current research that is shaping our field. I am so happy you're here. Today, I'm interviewing Dr. Jena Noland, a doctor of clinical nutrition and triple board certified practitioner, specializing in genomics, oncology nutrition, and the ketogenic diet. Dr. Knoll's published case study that we'll discuss today will focus on a client's hormonal health, specifically post-menopausal health, and how she was able to utilize genetic and genomic testing to get the most precise answers that would guide her client's care protocol. Since these episodes will be discussing research papers, it's obviously recommended that you read the paper beforehand. Dr. Noland's paper is linked in the show notes, and it is also linked in our bio on Instagram. Remember, that handle is at Innate Clinical Nutrition. Without further ado, let's get into it. Stay tuned. Hello and welcome to another CNS Journal Club. The journal clubs have been super exciting to record and super exciting to have at the highlight of CNSs who are putting the work into our research and really pioneering the next steps of what CNSs can do, whether it is from medicine to genomics to coaching. And today we get to highlight a little bit of everything with Jena Noland. Thank you so much, Jenny, for joining us today on CNS Unfiltered.
Thank you so much for letting me be on the platform. I really appreciate this opportunity and super excited, to talk about anything you want to talk about.
Oh, thank you so much. Today, for our journal club, Jenny has published a case study. The case study is Precision Nutrition, guided by genomic and functional assessments in post-menopause. Now, I'm sure this is hitting home for a lot of our listeners just in the title, right? And just in the title, we're breaking down really a difference between, we'll say the old thinking. I won't just say RDs right now, right? Because there's a separation, but it's not just a
Mhm,
separation in practices anymore. It's just the separation of thinking, where before it was very, here's the DASH diet, right? Here's a blanketed
mhm,
approach, where now we're really putting emphasis on everybody's different. And how are these people different? And how do we work with them to find out exactly what's going to be productive for this care? And your
mhm.
case study highlights that beautifully.
Thank you. Thank you.
Before we jump into the case, I do want to give Jenny a little bit more of a highlight with her credentials because she's amazing. So, Jenny is a doctor of clinical nutrition. She is also triple board certified, having her CNS, her nutrition genomics specialist, and a ketogenic nutrition specialist. She also has special training in nutrition oncology. So we don't get to fully deep dive into all of her certifications, even on top of this. We will do that in our spotlight. Today, Jenny is going to walk us through her case study and what this tells us for practicing physicians. Thank you,
Mhm.
Jenny.
Yeah, I'm excited to present this case for sure.
Thank you. If you would like to
Mhm,
give a little bit more background on you a little bit, where are you working
mhm.
now, where this might have been published, or that little bit of that process. So anyone who's looking into that research world right now is like, ooh, I'm interested. How do I start moving gears into there? And then what made you pick this client for this case study?
Yeah, so the client actually came to me in early 2025, and I one of my expertise is actually hormone, right? Especially sex hormones, anything thyroid, anything related to endocrine function. So her case is this post-menopausal symptoms, including vasomotor symptoms, worsened musculoskeletal pain, and fatigue, weight gain, you name it, right? It's just a typical postmenopausal case. So and the client herself has this really high health literate, the kind of the knowledge, right? She's very educated and very driven. Uh, and the first time when we met, immediately I know she would be a great client to work with. But at the time, I wasn't thinking about writing a case, right? It was really through the whole process. And then at the end of the 6 month working with her, that's when, because the results were so positive, that's when I decided to put it in a case study. So that's been, and also, she came to me with her DNA test results. So that's something I'm definitely always interested in. Sometimes I recommend a test for a patient, but sometimes the patients themselves bring their own DNA test reports. So that data is available where I can apply my knowledge on, just the genomic, right? Genomic insights into the case. And I think that's very, very helpful in managing this case. It really kind of guided me uh, with the thoughts and strategies to help her alleviate the symptoms and help her feel better. Yeah.
You had the opportunity, it looks like. We'll go into the patient's history and where traditional medicine. Well, let's start there.
Hmm.
So it does look like she was seeing traditional medicine for a little bit,
Hmm.
very typical of what a menopausal woman would be kind of searching, right? Like, does this patch work?
Hmm.
Does this supplement work? What
Hmm.
was her, where did traditional medicine leave off? What was her story before she started seeing you and getting some answers?
Yeah. So she wasn't really supported from kind of like a more functional medicine type of principles, right? It's just a medical doctor who prescribed the HRT,
Mhm.
and that's about it. No dietary work whatsoever. And actually, she herself picked some nutritional supplements without anybody's guidance, right? So, uh, no investigation on anything else, basically just a prescription with HRT. And she shared that her vasomotor symptoms definitely got resolved quickly with the HRT. However, she felt very irritable and also bloated. So she
Mm.
didn't really like the way how she felt. So this is why she decided to search for a functional provider who can actually dive deeper with her to figure out how to do this properly. That's why she found me. So I think, obviously from the case study, you can tell, right? We literally just kind of dove pretty deep in different aspects of her life. Yeah. So
Yeah.
it's a pretty
Yes.
comprehensive case. Yeah.
I loved it. And that's actually where I was gonna jump to before. I'm like, well, let's get the history first because
Mhm.
you've really had an opportunity here with someone very willing, educated, and ready to go down this path. And not everyone's there when they come, right? They're like,
Yeah.
I'll
Yeah.
see
That's
what
true.
you're about.
Hmm.
I'll see
Hmm.
what this is.
Yeah.
But you got her in the first, obviously correct me if I interpret this a little bit wrong, but
Hmm.
within the
Hmm.
first meeting, we have a stool test, a Dutch test. We have blood work. You already had her genomics from prior. Am I missing one? Is there another test in
Actually,
there?
what happened was when she came to me,
An
she
allergy
brought
test.
me, yeah, so she brought the DNA test reports. She brought the blood work. So I didn't have to order any of that. So what
Yep.
I recommended was a Dutch test, um, a toxin bundle test, and also food sensitivity test, and also a stool comprehensive test. So and then I got all of these tests ordered, and then the test reports all came out. We met, and then we analyzed everything, and then we figured out the direction, right, where to go from there. So it was quite a bit functional lab tests to begin with. She has very high health literacy, and she was willing to dive deep to do a very comprehensive work. That's why, and I know it's hard to find this kind of clients all the time, right? So, so this is why this actually led to the case report and the publication of the case.
Yeah. And I love that because, and just playing devil's advocate a little bit at first, right? When I first read, I'm like, of course you got amazing success. You literally got to know this lady from the
Yes,
inside
from
out.
inside out. Yes,
Yeah,
absolutely.
like,
Yeah.
of course this is gonna be a beautiful study because you were able to do all the testing. You had everything at your
Mm-hmm.
fingertips.
Yes. Yeah.
But as I kept reading, I'm like, you know what? Like, it's amazing to really publish because now you have a very congruent understanding, right? That you were
Mm-hmm.
able to make precision nutrition because you knew
Mm-hmm.
everything within a
Mm-hmm.
6-month plan ahead. And I
Mm-hmm.
think that's a huge difference of what people don't understand. You hear, um, I'm one of them, test don't guess, right? But in
Mm-hmm.
the
Me
same
too.
breath, I
Mm-hmm.
have listened to so many now CNSs who don't do
Mm-hmm.
testing at all and are
Mm-hmm.
more guided like
Mm-hmm.
that. They still do amazing, amazing, amazing work.
Yeah.
Um, but one thing that I find that that your paper highlights really well is the way you can literally put together a precision nutrition plan
Mm-hmm.
and really get like an A to Z thought
Mm-hmm.
process, right?
Yes.
It's not
Yes.
check this out.
Mhm.
Well, it is still check this out. I'll see you in a few weeks to
Mhm.
figure it out, but
Yeah.
it's not a such a long drawn out process. Is that how
Yes.
you interpret it and
Absolutely.
feel?
You got it. You got it. Yeah. So I think my approach has been evolving over the years. And I know a lot of practitioners don't like to use the lab test, and I'm with you. I like the clinical data. The more
Mm-hmm.
data I have, the more precise I can get.
Yep.
And also just the whole intention of utilizing and incorporating genomic data, that's almost like the highest level of practicing personalized nutrition, right? Um, so I like testing because I don't want to waste time. So over the years, I have kind of reached to this point where nowadays, if I get a client and if they agree to work with me, I would recommend, if not all these lab tests, right, but the functional tests and standard blood tests that I see necessary based on their symptoms, health history, and the goals they have. So that's kind of how I start with every case nowadays. That's why I named my practice as precision nutrition. So they kind of know what they're signed up for before they sign up, right? So that's just my approach, and I do find it very effective.
I
I'm very
agree.
data driven, by the way. I'm data driven. Yeah.
Yeah,
Hmm.
yeah, I'm with you. And
Yeah.
like my practice also, like I'll have two signature programs, and those have a lot of functional testing. That is very structured, right? We're getting deep
Hmm.
dive. These are for the
Hmm.
people who are willing to take off the gloves, get get in the dirt,
Yes.
really, really work.
Yeah.
But also, I'll see anyone wherever they're at. But you do see a huge difference where you're able to kind of use
Hmm.
that precision nutrition, like kind of like
Hmm.
a chessboard. Like we know this, I got the answers. This still might take us a
Hmm.
year,
Yeah.
but
Yep.
at
Mhm.
least we know what's coming. I can predict a little bit
Yeah.
more of what you're going to go through, so it doesn't feel as daunting.
That's right. That's right. So this approach may not work for everyone, but again, we all have our own target audience, right? It'll attract a certain patients or clients. It may not attract others, but that's okay, right? So I
Definitely
prefer to
okay.
work with the people who appreciate this comprehensive approach. Um, yeah.
Game on.
So that's
Yeah,
where I
game on.
am at. Yeah.
I love it.
Yeah.
So I know one of the most exciting things I'm interested to hear, because I
Hmm.
am not that versed on it too, is the genomic insight, right?
Hmm.
So tell me how you layered the test, if that makes sense, right? Like,
Hmm.
what's the foundational, like, okay, this hits it, and then maybe this layers on top. And how did you kind of interpret that to get into the precision nutrition? Does that make sense?
Mm,
Like, like it, how you said genomics was, how I interpret it was like the foundation, right? Getting
yeah.
to know that was the biggest insight. Right?
Hmm.
So then we did a stool test. You did a
Hmm.
sensitivity test, allergy test. We
Hmm.
did a
Hmm.
stool um Dutch test.
That's just.
Which one does any of them take priority,
I see what you're
right?
saying. Yeah, yeah, yeah.
Okay.
Yeah, I see what you're saying. Yes. So for this case, it's a little different. Typically, if the client says, I don't have a lot of money, or I don't have the money to take all of these tests all at the same time, I would layer them,
Okay.
right? And recommend the one with higher priorities.
Hmm.
For this case, it's a little different because she has a financial means to take all of them, and she's very interested in taking all of them. So I basically just recommended all of these tests that I believe that could give me a lot of the insights in managing her case. So she took all of these tests together. So for other clients, I may recommend less to begin with, but the ones I would recommend first would be the ones that I feel like that are most relevant to their symptoms or conditions and health history. So it really depends on the case. I generally don't
Yep.
recommend all of it right up front. So yeah, so this case is a little different from most cases I
Yeah.
work with. Hmm.
One of the big questions too when we are doing the test, especially
Hmm.
for I think for new people who are doing the test, like, A, can you read it with efficacy and clinical knowledge to implement? You're not just giving their I know you're not doing that, just broader.
Mhm.
You're not just giving
Mhm.
the recommendations at the end and saying, okay, I think this is how it goes. So when you collect and you have 5 different tests in front
Mhm.
of you, how do you prioritize what test you're actually filling in? Does that make
Mhm.
sense? Like,
Mhm.
for this client particular, right?
Mhm. Mhm.
Because I can imagine at some points you're going to have to look and be like, well, these don't fully line up, or this doesn't, whatever. And you have to pick a direction.
Mhm.
Um,
Mhm.
how did you layer in the precision nutrition, I suppose is what I'm asking, for this client
Mhm.
utilizing
Mhm.
those tests?
Yeah, so for her, this is obviously a postmenopausal case. The Dutch test recommendation came as the first recommendation for her, because I really want to know, right, what her baseline sex hormone levels are, how her body metabolizes estrogen, and all of that, right? Some nutrition markers on there. So that's all very helpful. So that was definitely the first test that came in mind. And then I already have her DNA reports. Um, so those are definitely the first recommendations I had for her. But then when she started telling me about her career and her job, the toxin bundle test came as the second test because she's actually a director of a construction company. So she would go to these construction sites very frequently. That tells me, right, she could be exposed to a lot of the environmental toxins at these
Yeah.
different, remodeled homes and things like that. Um, and also, if you pair that with her, just this kind of autoimmune clinical picture with the joint pain, obviously got worsened after she entered the postmenopausal phase. That's why I feel like, okay, we probably want to know a little bit more about the toxin load in her body. So that came second after the Dutch test. And then the food sensitivity, again, that's related to the information reviewed on her DNA report. Because on her DNA test results, it actually showed that she has a genetic risk for gluten sensitivity and also lactose intolerance. So, and she was eating both when we started the process. So we both were interested in learning whether this was being manifested in real time. So the food sensitivity test idea came along, right? And she was very interested in finding out whether gluten and dairy would show up as positive on the food sensitivity test. As far as for the comprehensive stool analysis, that came last because she didn't really have a lot of GI complaints. However, there's some kind of a ongoing mild grade of abdominal bloating. That was kind of the only GI complaint she had. So, given her autoimmune kind of profile, I thought, okay, I kind of want to know if there's a leaky gut going on, right? Whether certain markers in the the comprehensive stool test would actually show that. And I also want to know whether she's actually digesting well, producing enough pancreatic enzymes. So, and then she agreed. It has a little bit lower priority, but she agreed to take it. So there you go. That was
Cool.
a decision for all of these tests. Did I answer your question, by the way?
Mostly. Mostly. That was wonderful. Thank
We
you.
can dive deeper. Yeah.
So,
And actually, it showed that the stool test definitely was worth the effort later on when the report came out.
yeah, and it seems like when
Hmm.
I was, reading the case, if I followed correctly, your recommendations followed that pretty precisely too. You took
Yes.
out
Hmm.
the gluten
Yeah.
and the dairy, then you started with the HRT, and then you kind of moved on, circled back for the gut. But
Hmm.
I'm going to let you walk us through how you implemented your
Hmm.
precision nutrition for this case and how that worked for her.
Yeah, so when the Dutch test came out, it basically showed this kind of a global decline of all sex hormones, testosterone, progesterone, estrogens, all of them. So at the time, we were discussing the possibilities of different therapeutic options and that she was obviously having the vasomotor symptoms, right? So there are different options, the natural options or continuing with the HRT. So those are the two topics that she and I discussed. Um, so I kind of presented different options, the pros and cons and things like that, right? And then she was leaning more towards going back to HRT, but then maybe with a different formula because the last one causes some side effects. So at the time, I decided to dive deeper into her DNA test results just to see what kind of SNPs she has and whether she could actually try a different HRT formula. So what I found out was she definitely has some uh, different SNPs. And do we have time to dive into these different, the
Yeah.
genetic variants?
Yeah, I'm
Yeah, so
here for
we
it.
can definitely. Okay, awesome. Yeah. So what I found was she has homozygous variant for CYP19A1 gene and then CYP17A1 gene. Both are homozygous SNPs. So what that tells me is, okay, so she may have this upregulated conversion of pregnenolone and progesterone to androgens. So that's related to the homozygous CYP17A1. So from that, she could actually end up having this kind of excess estrogen levels, right? And then the CYP19A1 homozygous SNP, that tells me that she may have this genetic risk for upregulated aromatase activity, which again can lead to this excess conversion from testosterone to estrogen and estradiol. So that's kind of the two pieces that actually tell me that this may be the reason why she was not responding to the original HRT very well, because she was on a pretty, I would say, a higher biased with the combination of estrogen. No, actually, with the combination of estradiol and estriol plus progesterone. They're all bioidentical, but I feel like her body has this kind of a genetic fast conversion, right? That could lead to excess estrogen. And then if you give her a decent amount of exogenous estrogen, she may end up having this estrogen dominance going on, right? Which could actually cause irritability, abdominal bloating, all of that stuff. So because of the genetic profile, I thought she could be benefited from a kind of just estriol by itself without estradiol with a lower dose, right? Because she also has a little bit family history of cancer, even though it wasn't breast cancer, but that was her concern. Oh, I don't want to do this, which could potentially increase my risk for either breast cancer or some other cancers, right? So
Yeah.
I feel like the estriol could be a safer choice for her with the minimum kind of the lowest, most effective dose. And then we can pair that with a bioidentical progesterone. So what I did was I wrote a summary of her genetic information, uh, and just for her to kind of give it to her provider, and just to see if they're willing to prescribe a different types of formula. So that was the end. That was basically her final choice. She wanted to try HRT again, but with a different formula, right? She didn't really want to go to the route of doing the supplements only because she tried it and
Mhm.
didn't really work. Um, so she actually got the new formula and it really worked very fast.
Cool.
Vasomotor symptoms were resolved very quickly. There was no side effects whatsoever. So that really worked very well and very quickly. So that was kind of the first phase that went really well. And then the second phase we worked on was actually, I wouldn't say it's the second phase. The diet piece came immediately as well. As she was working with her provider to change the HRT formula, we immediately started the dietary implementations. So from the food sensitivity test results, it actually showed, yes, she was reacting to gluten and dairy and also quite a bit other foods. So we eliminated quite a bit foods based on the test results. And then the result of that was her joint pain went down also pretty quickly. And
Cool.
then, yes,
Do
we
I
go into the
recall
third.
that
Yeah,
sorry, do I recall that you had her doing this elimination diet for 6
yes,
months, right?
yes, yeah. For
Okay,
6 months,
yep.
absolutely, yeah. So she stayed on the elimination diet for 6 months. You got it, yeah.
Okay.
Um, and then I think going into the third or fourth month, she was doing really well, but this GI bloating was still happening. That's when we kind of went back to the comprehensive stool analysis, and there's a parasite that was detected. But at the time, it wasn't like a terrible kind of the most damaging parasites. So we didn't immediately do anything, and plus, she just didn't have a lot of the GI symptoms. But then, so the parasite that was detected is called Indonymax nana. It was I've seen this quite a lot on a lot of reports, and she
Yeah,
happens
me
to
too.
have yeah, is that right? It's
Yeah,
pretty common. Yeah.
it is.
At first, we didn't really kind of give it a lot of thought, but then this ongoing bloating, and even after the food elimination, right? This kind of bloating just wasn't going away. That's when I recommended a anti-parasitic protocol for 60 days, and she got on board with it. She said, let's do it. So I gave her the protocol, uh, and basically the bloating was gone when she
Cool.
finished the protocol. So she said, she was so happy that, I decided to do that, and she agreed to do it. So it
And
was more like a gradual. Yeah, go ahead.
do I recall in the stool analysis piece when you were treating that for those 60 days, you did a
Mhm.
combination that would help the secretory IgA come up, the zonulin come down. Um, you kind of did them all together, a good probiotic you had in there. And did that one protocol work for those 60 days, or was that protocol broken up into a few, like a kill phase and a repair phase, like you
I
hear
think the protocol,
some for
the
the gut?
60-day protocol was more, the focus of the 60-day anti-parasitic protocol was mainly to kill the parasites or any other
Hmm.
bad pathogens. I don't think I paired it with a lot of the gut lining, repair type of agents. I think those came later after the protocol.
Okay.
Yeah, because it was just too many supplements, right? So we basically first focus on just the antimicrobial
Okay.
supplements, and then after that we did some GI repair
Okay.
supplements. Yeah.
Awesome.
Mm-hmm.
Awesome. Was her healing path pretty trajectory, like pretty linear?
Mm-hmm.
Cool. Cool.
Yes. Yeah.
That's not
Mm-hmm.
That's awesome. I think that's another part I just kinda wanted to highlight. I think, the client being so willing on top of it,
Yes.
but to be
Yes. Yeah.
able to kind of see you get to minimize a lot and kind of prioritize the different pieces to mitigate.
Yes. She's very willing, and I got so lucky because I did this case when I was in the doctoral program. And, in the last term, we had to write a case study. That was, but this case literally came in right before the last term. So I already had this case completed when I entered the last term of the doctoral program. So in this whole last term, basically, it was just the whole effort of putting the case together into an article. Yeah. So yeah, I got really lucky to find this patient for sure.
This is wonderful. What, because you go through a lot in this paper for every area that you investigated for her, whether it was gut or food or HRT, you have the genomic SNPs or the genomic makeup that
Mhm.
guided your thoughts through that case. Did I interpret that correctly?
Yeah. Yes. Yes.
Very cool. So
Yeah.
it sounds like the genomic piece was kind of like your reference sheet, if I have that right.
Hmm.
Here's the
Yes.
cases, or here's all
Hmm.
the other testing, and this is what I'm seeing. Now let's find out why genetically, so I know how to get us out of this cascade or cycle or loop or whatever the body is in.
Hmm. Yeah.
Uh,
That's
Is that how
right.
it
I like the way
works?
how you phrased it. Yeah, I like the way how you phrased it. So basically, it's not just this case. Nowadays, when I work on any case, if there is genomic information available to me, what I do is I synthesize genomic data and all these other lab test data, and I try to map them. So, for example, if you say, oh, I have this estrogen dominance going on, right? And it's shown on Dutch test, it's shown on blood test, I would go to the genomic information to pull out any SNPs related to sex hormone metabolism, right? Or estrogen metabolism, or estrogen synthesis, right? Or testosterone synthesis, the whole pathways of the downstream pathways of androgens. So I would definitely pull those SNPs just to see if there's a genetic component that could be part of why they're experiencing these conditions or symptoms. I feel it is to me, it's very enlightening to bring in the genomic piece into the clinical work, because that's when I can really understand a lot of times, if not every time, why they're having these symptoms, right? Because I see everybody's health is a combination of genetics and lifestyle, diet, all of that. So half of it is almost like all genetic related, right? And I want to know what is inside of this half of the picture,
Sure.
right? So it's very enlightening because a lot of times it explains why the lab results look like that, right? Why blood test markers look like that, and why they're having this kind of symptoms. For example, if I see a homocysteine being high, I want to obviously dive into their methylation pathway to see what are the genetic challenges there, so that I can pick the most suitable supplements and recommend the personalized dietary recommendations for the person. Uh, so if the genetic test, for example, let's just talk about the methylation, right? So
Sure.
when we think about methylation, yes, we go to test their homocysteine level just to kind of get an idea whether the methylation is running efficiently. But then let's just say your homocysteine level is high. We don't really know exactly what nutrients that need to be optimized, right? Because it takes so many different nutrients to have the methylation cycle to run well, right? The most
Hmm.
commonly talked about nutrients are B12, folate, right? B6, B2, all of that. But what about choline, right? What about betaine? So, and it's really hard to test those markers. It's almost impossible to always test the choline or betaine, right? It's not available a lot of times. So that's when I like to look at their methylation genetic report to see if they have any genetic SNPs related to those nutrients. If they do, I would pick a particular uh, either B complex or some kind of nutrients that contain choline or betaine to optimize their methylation cycle. Um, I hope that makes sense because it just takes a lot of nutrients, right? That kind of get fed into the methylation process to make sure it's running well. So I think that part is very helpful. Um,
Just to take it a
yeah.
step deeper, just to make sure
Hmm.
I'm fully understanding, we
Okay.
can take that a step deeper maybe by looking at the MTHFR, right? A lot of people
Hmm.
understand that one and saying, okay, that one's a popular one. I'm having an issue with the folate or the B12 you're just
Hmm.
saying. So
Yeah.
what? So would you be saying also like, yeah, I can see what the problem is in methylation. I can also see the other markers to go even deeper of, oh, well, we need this methylated type of B12 or we're not even going to get there. Or we need to adjust our supplement or our food supply
Hmm.
to adapt
Hmm.
for the body, right? It can just keep feeding into that precision nutrition part.
Hmm. Yeah. So that's actually that kind of leads to this topic of testing or mapping the genomic information with this whole comprehensive nutrient status assessment. I do think I ordered micronutrient tests for her. we didn't
Okay.
we didn't cover that, and I also wasn't thinking about it, but that was also another test I ordered for her because I think it's super important for us to not to just treat the genetic SNPs, right? But also to pair that with what's really going on in real time. And that comes from a very comprehensive and reliable assessment on the B vitamins, right? On the different
Hmm.
minerals and all of that. So I do pair the two test results, the genetic test results, and also the micronutrient test results very closely. And then I come up with the recommendations on diet and supplements. Does that make sense? Did I
Yeah,
answer your
totally.
question there? Yeah.
My
Yes, I think go ahead.
my one question on
Mhm.
the nutritional analysis, was it done through blood or was it like an oats? Like what pathway do you
Yeah.
choose when you're trying to look at nutrients?
Yeah, Dutch test has some of those, right? The B
Yep.
vitamins. I did do a blood test on the
Okay.
full panel of micronutrient test.
Cool.
Yeah. And also the standard blood test also give us a lot of clues too.
Yep.
So it's really the combination of different tests, and I pair them with her genetic profile, and then determine what kind of B vitamins or what kind of supplements I want to recommend to optimize. Her homocysteine level was above optimal, by the way, originally, um, and then definitely there is a B kind of a folate and B12 risk, genetic risk there. Um, so yeah, so that's kind of what we did.
Perfect.
Hmm.
And was she able to reintroduce all of the foods back, or were the two with the genetic SNPs, the dairy and the gluten, are those kind of out
Yep,
forever?
you're right. Those are out forever.
Okay.
And I think in after the whole at the end of the 6 months, we did reintroduce the foods back, and she didn't have any side effects or reactions in
Cool.
the whole reintroduction phase. I actually do believe that some of the foods could still be problematic, but I didn't want to make it too restrictive for her, especially given that she never really experienced a lot of the issues, right, with the reintroduction. So we kind of just let it a little bit loose so that she can enjoy her life. She's doing really well. She's still my patient, by the way.
Yay! Yeah, I was going through um when I was looking at how her labs had changed from
Oh,
beginning
yeah.
to when you did it.
Mm-hmm.
Oh my gosh, that's what everyone wants to see. Like a doctor be jealous. We're like, wait a second. Did
Did
this
you
in
see
how
that?
long?
Yeah, did you see the appendices attached to the article? It has all the lab comparison before and after.
No,
Um,
I opened it from Frontier and I downloaded it,
oh,
but
you
it
did?
just has
Okay.
the reference on the back. It doesn't have the appendix.
Oh, that's interesting. Now, is this just a voice recording that we're doing, or I can
Yeah, we can
share
edit.
my?
Oh,
Do you want to share the
um,
screen or?
I mean, I'll take it. We are video recording, so we might use it on the YouTube if you're okay with that.
I think it'll be helpful for you as we are going through the changes of these lab markers because there's so many markers to follow. It's all in the appendix section. Okay, so on this page, this just has all the relevant SNPs that I pulled out from her DNA reports. And you can see some of them are related to estrogen synthesis, androgen synthesis, and also phase 1 estrogen metabolism, phase 2. And you can see on phase 1 and phase 2 estrogen metabolism, she really doesn't have any SNPs, which is wonderful.
Cool.
However, from the Dutch test report later on, we will see her phase 2 estrogen metabolism was slow. That actually tells me she was deficient in magnesium or certain B vitamins. So right here. Yeah, scroll up a little bit. Yeah, right there. You see that 2-methoxy to
Yep.
2OH ratio. You can see the
Yep.
first time it was at the low end of the range. And
Yeah.
then
At
at
a
the end of the 6th
26%
month, yes, it increased a lot. So that means
to
the dietary.
88%.
Yeah, exactly. Exactly. So, and then if you go up to the genomic appendix, we will also see quite a bit SNPs related to methylation here. FUT2, FTR, FTRR, those are all homozygous variants, which are related to B12 absorption, right? The SAMe availability, which could lead to the buildup of reactive estrogen intermediates. And then she also has quite a few SNPs related to metabolic risk, especially FTO and ApoA2. There's a
Wow, this
family,
is so
definitely.
fascinating.
It is? Oh, you find it okay? Tell me.
Yeah.
Right. And then she does have a family history of cardiometabolic disease. So this is how I connect the dots. When I look at the DNA report, I connect it with the family history and her own health risk or health conditions. She always has a hard time to lose weight. I think that probably is related to the FTO homozygous SNP and also this ApoA2 SNP related to obesity and cardiometabolic risk. Saturated fat is her enemy because of the ApoA2 SNP. So I told her saturated fat is not definitely, right? You want to limit it as much as you can, which she definitely implemented that change because she used to eat red meat quite a lot. Never really used the butter or anything, but quite a lot of red meat in her diet at the beginning. And then we can also see some SNPs related to impaired detoxification right there. And also this HLA, DQ8 and DQ7, which could be related to the gluten sensitivity and autoimmune. Lactose intolerance right here at the bottom, that's pretty clear. Um, so yeah, these are what I learned from her genetic reports.
Very cool. And
Mm-hmm.
just a question from you. Like, I know there's a lot
Mm-hmm.
of genome companies going out there, and you can get pretty specific, right? Like, I want to know
Mhm.
my immune genes or my food
Mhm.
genes or,
Mhm.
whatever along those lines. I also heard, like, for anyone who's done, like, the 23andMe or
Mhm.
Ancestry.com, you can ask for
Mhm.
your raw
Raw data?
your
Raw
raw
data? Uh-huh.
data.
Yes, uh-huh.
Yeah. What what approach did this person come to you with this already? Or what do you find as like a good standard or a red flag if someone's looking at this, whether it's a client or a practitioner right now, saying, wow,
Mhm.
now I
Mhm.
understand the insight, but like, who do I trust now? This is so new.
What kind of tests to trust?
Yeah, like, yeah, or is there
Mhm.
like a difference because there's so many out there and they can be very specific,
Yeah.
or you can just
Mhm.
just go grab your raw data and like, well, what do I do with that?
Oh, yeah, yeah, I
You
know what
go
you're
find
saying.
you,
Yeah.
right? Okay.
Mhm. Yeah. So I, at the beginning, did use raw data, and then I would feed it into different software tools, that I could find on the market. But my experience with that approach wasn't, I wouldn't say it was not good. I would just say here and there, I would also always find some inaccuracies because the software tools, it really depends on what tool you're talking about, right? Not all of them are perfectly developed. So some of them can spit out a report with the inaccurate representation of the person's genetic genotype, the genotypes. I have actually experienced that and encountered that kind of scenarios quite a few times. So, and then I decided not to use raw data approach. So I would use different, just the genetic tests on the market that I trust. I don't know if I'm allowed to mention these companies.
Sure. Go for it. Yeah.
Yeah. So currently I settled on self decode because I do find them super comprehensive. They literally provide hundreds and hundreds of genetic reports with different topics, different areas that the practitioners can look at. Um, and they also just have a whole genome sequencing test that just got launched maybe a couple of weeks ago or even just a week ago. Um, it's more expensive, but they actually have different tiers of options you can choose from. So for all my clients, when they signed up, I already include their test in the package. So it's all included because I want the genomic piece to be kind of this kind of required component in my clinical work.
Yeah.
Yeah.
Non-negotiable for your
Hmm.
precision nutrition approach, right?
Right. Right. Yeah. Exactly. So that's the test I've been currently using. I also use 3 times 4 genetics. I also use theirs depending on the patient's willingness, how much money they want to spend, and their financial status, and all of that. It's also a very good test. I tried all kinds of tests. Seeking health strategy, Bob Miller's test, uh, nutrition genome, just all kinds of tests. Yeah. So I think every test has its pros and cons and limitations and you know advantages. But right now, I like the self decode. I think they're still developing. It's not all perfect, right? No test is
Sure.
perfect, but I think it's probably the most comprehensive test that can give me more information than other tests that I have used. Um,
Awesome.
and also in Elevation, this company that I work for, we just mentioned my role. You just mentioned about my role in this company. That's a test that they use too. So I do have to interpret their patients' self decode genetic test reports.
Awesome.
Yeah.
Awesome.
Did that
And
answer your question? Uh-huh.
yeah, that was great.
Okay.
Thank you for
Mhm.
that because
Mhm.
you work with it every day and it is the emerging part of functional medicine, clinical nutrition, and practitioners
Mhm.
in this field in general. So, knowing a lot of them use AI for their reports, and that's still kind of new
Mhm.
and working out the glitches. And um,
Mhm.
knowing that so many are popping up too, just where does the expert say is a good place to go? So, thank you for sharing
Mhm.
both of those. the thing that
Mhm,
kind of excites me about the 3 times 4 genetics, and please correct me where I'm
mhm,
wrong, but, um,
mhm,
is very available right now, right? For a
mhm.
clinician who has a full script or something, you can order that,
Yes,
um, and it's kind of on the lower expensive end, but they've been
mhm.
around
For a
for
long time.
for a
Yeah, for
chunk of
quite a
time,
long.
yeah.
Yeah, yeah, yeah. And they have
Cool,
great clinician support system. So you can
cool,
literally sign up to have a practitioner account directly with the company. And then they have this amazing clinician program where you can take their courses. You can have a one-on-one consultation with them. They also have this amazing it's almost like a library of the SNPs, right? Where you can just type in the SNPs and then it'll pop up a lot of the information that'll tell you what the gene function is, what the SNP impact could be. Uh, and yeah, I just really admire the work they've done to support the clinicians in, applying their tests in their clinical practices. That's what they
beautiful.
do best. Yeah, which is the support system.
Very, very cool. Thank you for
Hmm.
sharing all of that.
Oh, you're
And
so
thank you for
welcome.
the
Yeah.
listeners for coming along on my sidetracked journey over here, wanting to learn more about that. I hope it was beneficial. Um, coming back to your client, we are not going to go through the whole appendix
Mhm,
marker by marker,
mhm,
but for anybody listening, please download and read her paper and make sure you get into the appendix part because I didn't get that at first either. But this is where you're like, oh, cool. Oh my gosh. Like this is what people are looking for, especially when they lost it with traditional medicine, right? Like they don't
mhm,
stop their journey. Most of them don't. Some of them may give up some hope and just say,
mhm,
okay, that's it. But we have a whole generation, I feel, of people who are taking their health into their own hands and kind of saying, well,
mhm,
fine, like there's other options and I'm going to find them and I'm going to find the people doing it. And these are the types of results. You get answers because we do
yeah,
functional testing, and
mhm,
then you get a protocol that's truly built for the client from their
mhm,
genetics to their
mhm,
where they're at from that day to where they want to go with their goals.
mhm,
And this is the beauty of why I highlight us because we
mhm,
practice in such I'm going to call it like a chess like manner. Like we're thinking multiple steps ahead. We're thinking a year ahead on how we're going to move this client from A to Z. And you highlight that beautifully and how each of these functional tests take a highlight at certain
mhm.
moments and how you can lean into them even 6 months after the test was taken. Be like, okay, something didn't resolve. We have 30 pages of testing right here. Like, let's find out the next layer that we have to see. I guess we can
Yeah,
kind of even say it like reading a book or watching a movie. You get the first glance, the big pieces come out, you process it, you watch it again, you're like, oh, and look at all that other stuff that I'm understanding or realizing was in this book or this movie on top of it.
yes. Yeah. That's the beauty of functional medicine. We have so many tools, right? We have so many tools in our toolbox. And I think for each practitioner, every one of us is different. Our approaches are different. I think it just it's really up to us as for what kind of tools we want to put in our toolbox, right? Um,
Definitely.
yeah, yeah. So maybe not everyone wants to do the work at this level, but I think again, we can personalize our practitioner's approach and strategies, right? And
And
find out best approach for us. Yeah. Hmm.
that's also, I think, one of the beauties that I try to highlight in this podcast too is because you get to be so creative and you get to create exactly what you want. It is not a
Exactly.
rigid path like the RD
Yeah.
where this is where you're going to go, this is how it is, you're going to get in the hospital and there's this structure
Right.
already. We don't
Yes.
have that, and most of
Yep.
us have to make our own company, and so guess what? It's
Exactly.
ours, and we get to bring our heart, our soul, our past, our history,
Mhm.
and then our preferences into how we work, and I just think it's so cool, and when people have freedoms like that, they get to be creative,
Yeah.
and in my opinion, creative being when you're able to start being creative and thinking for yourself and thinking outside the box and doing that with other people, oh my
Mhm.
gosh, the sky's the limit.
Yes. That's how I feel too. That's how I feel.
I do
Um,
too.
yeah, we do whatever that suits us as practitioners, right? And I'm not saying this is the way to do it for everyone, but this is the way that I would like to do it. Um,
Sure.
but I think, we can just kind of figure out, right, what's the best way for ourselves and go from there. Hmm.
And this seemed to be the best way for your patient. She was frustrated. She was done. She wanted to know all the answers. She knows her body changed, probably her mind changed, just
Hmm.
things
Hmm.
change. And
Yeah.
we've all had those clients now at this point where they're like, I don't care what it is. Give me answers. I don't care how
Yeah.
deep dive you want to go. I want to know
Exactly.
myself at
Exactly.
this point because I
Yeah.
don't know myself anymore. So tell me so I know what to do. And this in
Exactly. Yeah.
itself is a huge relief. The testing and the answers itself, I feel, can do a big chunk of the percentage of the healing just by
Yes.
being heard and understood.
Absolutely. Absolutely. Yeah. And the other part we did, I did with this client was, from the toxin test, we found out she did have a lot of toxins, chemicals, mold, just lots of stuff. So that was pretty eye-opening for both her and me. And that led to this whole infrared sauna regimen for supporting her detoxification. So yeah, I do find these tests can be because you can't assume, oh, just because she's a director of the construction and who goes to the construction sites all the time, you can assume that. But when you see the test results showing the toxins, right, it's more, you know, it's just kind of just for the patient perspective, they know, okay, this is something I really have to address or pay attention to. So they're more willing to do the work when they see the clinical data. Yeah. So that's
Yeah.
kind of, yeah. Hmm.
And the next layer, if I can add, like not only did you see that high amount of toxins, but you were also able to
Hmm.
go in genetically and say, okay, well, our detox SNPs are
Yep.
fine. Like we don't have
Hmm.
a genetic reason not to detox these
Hmm.
toxins out. Like we come into
Hmm.
toxins every day. Like we should be able to do
Hmm.
that. But then getting into was it the stool test or the Dutch test? Or maybe both of them actually said, hey, phase 2 of liver detox and our detox systems are kind of backed up right now. So you
Hmm.
really do get that full picture of why and then the deeper why, which
Yeah.
in
Yeah.
functional
Hmm.
medicine, we're always asking
Right.
why. And the
Hmm.
why might be the first stopper of, okay, toxic load, but that's still not the
Yes.
why, right?
Yes.
It's
Exactly.
it's
Yeah.
what's going on where we can't detox out these toxins or they're being stored.
Hmm.
Why are they being
Hmm.
stored? Or, that
Yep.
next layer of knowing exactly what to do to unlock the body within such a short period of time. And I think
Yes.
that's the moneymaker right there, right? Like you're dealing with this stuff for
Yeah.
so long, like to kind of make it from A to Z in 6 to 8 months for
Yep.
health.
Yeah.
That's fast.
Yeah. Her life definitely changed 180 degrees within 6 months. So, um, and she's not the only person that I have worked with who experienced this pretty quick turnaround. I think it's just like, if you have, to me, it's very powerful. If you have all the clinical data, you make it precision. And then if the patient is willing to do the work, right, that's the
Yeah.
combination of those can really lead to amazing results. Yeah.
Are there any other highlights that you would like to go over in your article that maybe we did not touch on today?
We touched on most of the stuff. The other thing that could actually show how effective this precision nutrition approach is I actually used the medical symptom questionnaire before and after. So her total score at the beginning was 96, and at the end of the 6 months, it dropped to 23. That's a big
Whoa.
reduction. Yeah. So the joint
Can you
pain, mhm,
Yeah.
it's all
Yeah,
in the
please
appendix
continue.
section.
Yep.
It's in the appendix section right there.
Yeah, but for anyone listening who might not know what that questionnaire is, it's a questionnaire that's used a lot in literature and science for marking the progression of healing, whether it's physical, mostly physical. Am I correct? Or
Mhm.
please elaborate for wherever I have that wrong.
You got it. It's in
Okay.
different categories, including joints, muscles, weight, digestive tract, skin, nose, head, eyes, mind, emotions, heart, lungs, and those are the categories in that questionnaire.
Perfect. So it's a great
Hmm.
way of just tracking. So a lot of people do use that in their practice too. And then the beautiful
Hmm.
part is you can put it in your research.
Yeah, I find it very helpful because at first I wasn't using it, but then a lot of times, even myself, it's kind of like after a few months, you just, you don't really know exactly where they are and how much they have progress. But once you see the score change, you know, right? You know
Yeah.
that everything's moving, yeah, in the right direction. So I've
The
been using
data.
it consistently, the data, exactly.
Yeah.
Yeah, exactly.
Nothing takes the place of numbers.
Yes, that's
I
right.
agree.
Hmm.
Oh, Jenny, this has been absolutely amazing.
Oh,
I
thank you. Yeah.
appreciate you putting all the work into this case study that you test, you don't guess. And on top of that, you layer it on top of the strongest why that we can physically get right now, which is the genomics world
Hmm.
of what makes us up and builds us as a human.
Yeah. Yeah.
I thank you for that. If anybody listening right now is saying, wow, like I've been to everybody, I need my genetics tested, or I'm interested in really all of these testing and having somebody who understands them and how to put them together. Like I want the 6-month cutoff. How do they find you?
Yeah. So they can go to my website, which is my name, jennynoland.com. I don't have a phone number there for a purpose, but I do have my email address and also a form people can fill out if they want to contact me. Um,
Beautiful.
yeah, that's the best way. Or find me on LinkedIn. The professionals, they can find me on LinkedIn.
Awesome.
Yeah.
Awesome. Do you have desire to publish again?
Yes, I do. I do. I
Awesome.
have actually, maybe we'll talk later. Maybe our
Sure.
time has run out. Yeah, we can dive into another topic. I do have the draft, but I just need to refine, expand, and then submit it maybe later this year. It's
Beautiful.
not a case study.
Awesome.
It's a narrative review.
Beautiful. I'm here for all of it. Anything you
Okay.
publish, I'm happy to highlight for you.
Thank you.
If you're getting value from these conversations here on the show, I'd love your input as I continue to build this podcast. Head to the link in the show notes and fill out a quick listener survey to help me shape future episodes, case breakdowns, and who I bring on the show. Make sure you subscribe so you don't miss what's coming next. Thank you so much, Jenny, for discussing your research with me today on our CNS Unfiltered Journal Club. Your voice in clinical care and nutrition research is so needed, and your clients' results speak for themselves. You're amazing. Our industry is so lucky to have you. Come back sometime and talk more case studies with us, please. If you're interested in working with Jenny, visit her website at jennynoland.com. Thanks to our listeners for tuning in today for this episode of CNS Unfiltered. Check back next week for another episode. Once again, I'm Jena Salisbury, and remember to listen to your gut.